Right.
السلام عليكم ورحمة الله وبركاته. أنا عوض أحمد مطرف من اليمن، ومن محافظة حضرموت من مدينة الشرقية. جينا إلى الهند نسوي علاج مع جدتي وعمتي العجوز، سنها 96 سنة، عندها ورم سرطان. وجينا إلى مستشفى يشودا، دخلنا عند الدكتور، سوينا علاج وإشعاع كيميائي، إشعاع لمدة 25 يوم، والحمد لله العجوز استفادت والأمور طيبة وكل شيء تمام. والشباب في الحيدراباد ما قصروا، بن همام وباوزير وعمران والعجيلي وازار كلهم ما قصروا، خدمونا احنا خدمة إنسانية. ونبي نسافر إن شاء الله إلى اليمن، والحمد لله الهند يعني في تطور أحسن من أول، وكل أشكال يعني كل شيء.
أبشر.
الحمد لله. الحمد لله. جينا زيارة للهند وزرنا وشفنا الناس وما قصروا معنا، ما قصروا معنا، والحمد لله. له الحمد، ما حد يزهد يتعبه.
صح.
له الحمد والشكر، الحمد لله. له الحمد.
العبارة عليها في البلاد حاجة يوميا الحمد لله استفادت الحمد لله. بفضل الله تعالى وفضل الدكاترة والحمد لله. مسافرين إن شاء الله لليمن الحمد.
Ready? I'm Dr. Srinivas Chilkuri. I'm a radiation oncologist at Yashoda Cancer Institute, Somajipura, Hyderabad. We received her, Mrs. Zaina, a 98 years old lady. She was diagnosed to have a marginal zone lymphoma in the rectum, and it was a very large tumor, around 8 centimeter in size. And she was not looking very sick actually when she came. She was moderately dehydrated, and she had lost a lot of weight in the last previous 5 to 6 months, and she was looking very weak. Apart from her intake was very poor. And when we initially received her, we initially started with some supportive medications. We evaluated her with a PET scan, which actually showed a large 8 centimeter lesion, and there was disease nowhere else apart from that rectal mass. So we diagnosed it as a marginal zone lymphoma stage 1, stage 1E to be specific. And we gave her in-field radiotherapy. We gave her a dose of 45 grain 25 fractions. And after 2 weeks of radiotherapy, she improved tremendously. She improved dramatically. In fact, she started eating well. She started going for her bowel movements were perfectly normal. And her general condition improved, her weight, she started gaining weight. And definitely she's in a much better shape now, and she's very much fit to fly back. And it's, as we have done a scan evaluation in between the treatment, it showed a very good response, and we are very hopeful that she's cured of this condition. We have asked her to be on a regular follow-up at Yemen itself, and we will be in touch with them on email and phone for whatever help we can offer her, because it's difficult for us to ask her to come to Hyderabad, she being a very elderly lady. I think similar treatment can be offered for patients from Yemen. I find all these people very, very friendly, very nice and very warm, and we are also the same. We also have a similar culture here. We welcome the guests. So we welcome all people from Yemen, whoever need our help, in terms, especially patients of cancer, because cancer needs a lot of infrastructure, a lot of facilities, and we as a hospital, we have got a lot of infrastructure, good people, good doctors, well-trained doctors who are being trained abroad, and all the other facilities which are available to help patients of cancer. And the best part about Hyderabad and especially Yashoda Cancer Institute is these patients can be offered the best possible treatment in the best cost-effective manner. And that is how we wish to help patients from Yemen. We will be associated with them, and we will try to do our best in helping them in alleviating their debt. with her on the same day we received Mr. Abadali Mahmood, who was also incidentally diagnosed with rectal lesion, and he also underwent an evaluation in detail at our hospital and underwent surgery. As I told you, we work as a team, especially in oncology, because in cancer most of the patients require several modalities of treatment. And I work in conjunction with Dr. Shrikant, who is the Chief Surgical Oncologist, and Dr. Nikhil, who is the Chief Medical Oncologist. And all of us discussed on all these cases before deciding which treatment would be the best possible for a particular individual. And myself and one of our team members will definitely come to Yemen, and we'll regularly visit Yemen to help the patients of Yemen, so that we can have a closer follow-up and closer association with the patients of Yemen very soon.